Pressure sores and skin damage are common following spinal cord injury. If pressure is not relieved, a pressure sore will occur. After spinal cord injury, messages are unable to get to the brain to tell you are uncomfortable and need to change body position. Sitting or lying in the same position for too long cuts off the blood flow to the skin, which can cause it to die. Blood flow to the skin is vital as it keeps it healthy and alive. Skin covering bony areas of the body such as hips, heels, sacrum are most at risk, as when pressure is applied, the skin over these areas is squashed between the bone and the bed or the wheelchair, cutting off the blood supply. If pressure is not relieved, the skin cells then begin to die, and this is the beginning of a pressure injury. Signs of pressure damage: changes to skin, colour, texture, temperature, and this is the first stage, even if the skin remains unbroken on the outside. If pressure is not relieved, the pressure sore will get worse and can form an open wound or blister, a stage 2 pressure ulcer, a deep wound that reaches the deeper layers of the skin, a stage 3 pressure ulcer, a very deep wound that may reach the muscle and bone, a stage 4 pressure ulcer. The skin will become red, purple or black, break down and may become infected. Once you have had a pressure sore, the skin will never be as strong again and it is more likely to break down. However, pressure injuries are preventable and the key to avoiding them is an effective skincare routine. Your skincare routine should include scheduled pressure relief when you are sitting by bending forward for 2 minutes every hour. Skin checks at least twice a day before getting up and on return to bed. A turn schedule when in bed. Early treatment of all skin problems. If you develop a pressure mark, stay off this area until resolved. Safe transfers, sitting correctly in your chair, avoiding sources of heat that may burn your skin, and wearing the right clothing and shoes. A person with spinal cord injury does not have to wear comfy joggers and trainers forever, but if you want to wear something new, it is best to trial it for 30 minutes to see if your skin marks. Other causes of skin damage include friction and shearing, which can occur if you drag yourself or are dragged up the bed, as this will remove the top layer of the skin and stretch the underlying blood vessels. And local trauma, such as burns, bruises, and bumps. If you discover a mark and are unsure what to do, keep the area pressure free and seek medical advice from your specialist spinal rehab centre, GP or community nurse.